Hi friends, I am Dr. Pratap Singh Rathore. I have done MD in Forensic Medicine and today we will discuss about identification from tattoo marks. Tattoos are designs made in the skin by multiple small puncture wounds with needle dipped in coloring matter which is attached to the isolating unit. So this is one example of a machine used for making tattoo marks. So this is needle part which moves to and fro, backwards and forwards, and these are the cylinders which contains the ink which delivers in the needle. So this machine moves to and fro, and from here the ink is delivered into the needle, and the needle places the dyes inside the skin. Dyes which usually used for making tattoo marks include indigo, cobalt, carbon, vermilion, cadmium, selenium, Persian blue, and Indian ink. For identification, we should note down the color, design, size, and situation for where the tattoo marks are present. So tattoo marks varies from different colors. So sometimes they are usually of green in color. They can be also be different color based on the dyes as used. What is the design? So some unique designs may be useful for identification purpose. Their size, whether it is small or big, where it is situated in the visible part of the body, or whether some part of the body which is hidden, that should be noted down. A latent or faded tattoo marks become visible by rubbing that part and examining with magnifying lens. Sometimes even latent tattoo marks can be made visible by rubbing with and washing it. The use of high contrast photography, computer image enhancement, UV lamp, or infrared photography is also helpful for identifying faded tattoo marks. Tattoos are recognized even in decomposed bodies and bodies recovered from water when epidermis is removed. Since the dyes are injected below the dermis, even if in decomposed body, even if the epidermis is removed, the tattoo marks can be identified using certain techniques like contrast photography, computer imaging enhancement, or infrared photography can be used to identify the tattoo marks. These are the few examples of tattoo marks which are placed on the bodies, like different designs like animals or religious tattoo marks, or sometimes even some nature of the some abstract may be present, abstract designs may be present, can be seen. These are few examples of tattoo marks based on the body. Complication of getting tattoo marks. One of the common complications is any type of infection. One is like septic inflammation may be present. If the needle is infected, the person may get infected. Abscess formation may form. Gangrene, advanced form of abscess may lead to gangrene formation where the tissue may be dyed. May lead to transmission of diseases like syphilis, hepatitis B, AIDS, leprosy, tuberculosis. These are the diseases common infections which may be transmitted from one person to another person through needle injections. So most common like AIDS that is caused by HIV virus. So this is one of the fatal injury, fatal infection may be caused because of transmission of injury, transmission of disease using infected needles. Now coming to erasure of tattoo marks. First method is surgical methods. In this, there are different methods like de-abrasion using abraders or with carbon dioxide or Ibrahim lasers, where laser beam vaporizes the particles of dye and are expelled from tissue in the gaseous form. So here the carbon dioxide or erbium or YAG lasers are used, which vaporizes the dye from the skin. Next method is by complete excision and skin grafting the part where the tattoo marks is present. Production of burns by means of red hot iron. So complete the skin can be burned. Scarification where that tattoo mark where the tattoo mark is present, it can be scarred. It can made injury may be made, and when the scar tissue is formed, the tattoo mark will be removed. Using carbon dioxide snow is also one form of removing the surgical method of removing tattoos. Next is by electrolysis or using caustic or corrosive substances to remove pigment by producing inflammatory reaction and superficial scar formation. Chronic eczema may also cause tattoo designs to disappear. Now coming to medical importance of tattoo marks. First is identity of a person, particularly the dead or decomposed individuals. His name or spouse's name or friend's name or date of birth or service may be all present in the body. So identification is the primary importance of any tattoo marks. Since tattoo marks are sometimes unique, sometimes they may contain the name of the person, sometimes even the family names like wife's name or children's name or sometimes date of birth may be present. Tattoo marks can also be used to know the rationality, religion of the person. like design of the cross of Christ may present in Christians, or design of Hanuman or Lord Krishna or Om may present in the Hindus. Political affiliations like examples like hammer or sickle, lotus or right hand. So sometimes political application of that person can be known. Race can be known, like tattooing of the chest and limbs is common amongst Japanese. Professional or occupation can be known sometimes, like some gang members have certain specific emblems or tattoo marks. Some occupations like coal miners leave visible tattoo marks on the hands and face. Behavior can be known from tattoo marks since some person may use erotic tattoos on the person, erotic tattoos who has some sexual fanatic addict type of person may use tattoo marks to conceal injection sites where he continuously wants to get injected. He may use tattoo marks to hide that injection marks. It may also represent the status of that individual of the individuals by using the tattoo marks. He may try to show that his status. These are my references. Thank you.